The next session is going to focus on unraveling the complexities of endometrial cancer. Yeah, good information's about to come here. We're going to talk about everything from diagnosis to innovative treatments. We're going to delve into a comprehensive understanding of what is a very complex condition. On the panel is the Chief Women's Health Officer for New York City Health and Hospitals and a longtime advocate for women and women's health, Dr. Wendy Wilcox. So happy to have you. Come on in, have a seat, have a seat. Next is Assistant Professor of Radiation Oncology at Weill Cornell Medicine, Dr. Onyinye Balogun. Next, we have our patient advocate and clinical research professional with 20 years of experience in hematology, oncology, regulatory affairs. Her name is Tiffany Drummond. And we also have Angelica Thomas, patient advocate and partner of Foster, Lynch, and Thomas, LLC. Welcome our panel.
Thank you so much. Good morning, everyone. Thank you. That was excellent. My name is Dr. Wendy Wilcox, and I have the honor of being the Chief Women's Health Officer for New York City Health and Hospitals. You've already met my guests today, and I am moderating today's panel on endometrial cancer. I would definitely like to thank Rosalind Daniels and Black Health Matters for sponsoring this amazing event today. So we're here, as we said, with our cancer expert, Dr. Oni Balogun, patient ambassadors Angelica Thomas, and advisory board Tiffany Drummond. And we're having an in-depth discussion about uterine cancer. We said endometrial cancer, but what you need to understand is that the endometrium is the inner lining of the uterus. And we all know that the uterus is what gives us our menstrual cycles, and it provides a protective environment for growing fetuses. But what happens when that lining gets cancer? And why are we discussing this topic today? We're discussing endometrial cancer because it is increasing so rapidly that it's expected to actually displace colorectal cancer by 2040 as the most common cancer deaths among women. That's astounding, right?
Yep.
Right now, it's the fourth leading cause of women's cancer deaths. Black women die at twice the rate of white women from this disease. But when uterine cancer is detected early, it's curable. So that's why we're talking about the reason today. So my first question is to our expert, Dr. Balogun. Dr. Balogun, what are the risk factors for uterine or endometrial cancer?
So the risk factors for endometrial cancer are first getting older. So as we grow older, the cells in our body, when they divide, they're more likely to have mistakes put in there or changes that make them become cancer. So being older, if you're a woman above 50, you have a higher risk than a woman who's under 50. So that's not something you can control. The other things that increase your risk of uterine cancer or endometrial cancer are increased exposure to estrogen. So if you started your period early or you hit menopause late, like if you started your period before 12, that means you had more cycles. And those increases and decreases of your hormone levels, just like breast cancer, having more of those cycles increases your risk for endometrial cancer. The other things that we know are diabetes, hypertension, those conditions also are associated with a higher risk of endometrial cancer. So in general, trying to have a healthy lifestyle, decreasing, your blood pressure, those are things that can also impact not just, your blood pressure, but your risk for cancer. And then we also know that for certain types of endometrial cancer, there are usually two different types. One is called endometrioid, and that depends a lot on estrogen in your body. So we know that obesity, having fat in your body, fat increases your levels of estrogen. That also increases your risk of the endometrioid type of cancer. So we want to make sure that we can exercise, doing some of those moves my friend before me was doing, just to make sure we're keeping our weight healthy and trying to decrease the risk. And then the final things I want to talk about are in your family. Having a family history of endometrial cancer increases your risk. So all the secrecy, we have to stop it. That's why I'm so happy we're talking today. If someone in your family has had a history, it's so important that you open up to who you're able to and share, because that could save a life. Also, if there's something in your family where a lot of people also had colon cancer, colorectal cancer, it's something called Lynch syndrome. And if people have had a lot of colon cancers, that can also increase your risk of endometrial cancer. So there's some of those things that we can't control, but the things you can control, your diet, exercise, so that you decrease your blood pressure, decrease obesity. Those are some of the things I want you to take control of today.
Thank you so much for all of that really important information. So just to put this in context for the audience, between 2000 and 2017, Black women made up just under 10% of uterine cancer cases. It was about 208,000. But they made up almost 18% of the deaths from that uterine cancer. So, Dr. Balogun, you covered this a little bit, but I'd like you to kind of circle back and talk to what contributes to the increased mortality rate among Black women with uterine cancer.
So I'm so passionate about this. I really want to be put out of business. Nothing would make me happy than to retire early because we found the cure for cancer. One of the things that makes Black women more likely to die is because we come in at a later stage. Dr. Wilcox said it earlier. If you come in at an early stage of cancer, you have a high likelihood of being cured, and you probably have to receive fewer treatments than if you come in much later. So unfortunately, especially in New York City, if you look at the data for New York City, over half of Black women are coming in when the cancer has left the uterus. In contrast, under half of white women are coming in, with the cancer having advanced. So we need to flip those numbers. We need to start coming in. And I like to say that slogan that we hear in the airports and the subway stations, if you see something, say something, right? That's not just for the airports and the subways. That's also for us and our bodies. If you see something, say something. And if your doctor doesn't want to listen to you, get another doctor. I said it.
Absolutely.
Because you know your bodies. So that's one of the reasons Black women are dying more. And the other thing is, some of it we know that also endometrial cancer is coming more frequently in younger women. And finally, some of the reasons we're not quite clear on. I mentioned that there are two different types, big categories of endometrial cancer. The endometrioid, and then there are the non-endometrioid. Those ones are more aggressive. And unfortunately, Black women tend to get the non-endometrioid types more often. So people like me are doing research trying to figure out why that is. But in the interim, the thing that you can do is, if you see something, say something.
Thank you so much for those so important facts, Dr. Balogun. So turning to patient ambassador Angelica Thomas, will you please share your story?
Sure. So I thought I was doing everything right. I checked all the boxes. I was an avid, and I am still. I worked out. Okay. I thought that I was doing everything right. Managing my stress. Worked out 5 times a week. Super healthy eater, super healthy. Everything green, water, probably irritating a lot of people in the process. But I thought, checked all the boxes. Summer, spring of 2022, I noticed spotting. One footnote, note to self. Then probably a few weeks later, a spot. Then in late summer, I started to lose a lot of weight. Immediately I said, well, I'm due for my physical, and I need to see my GYN. And so I immediately made an appointment. Unfortunately, this appointment was made in August. My appointment was scheduled in November. I think I probably every day in September, I irritated the receptionist. I called, I sent messages, I need to see the doctor, I'm describing everything, and they said the doctor was booked. I had my appointment in November, late November, after Thanksgiving, and I told the doctor, I went through everything, what I was experiencing, and she gave me a pap smear, performed a pap smear. A week later, she sent me a note, called me. I'm going to refer you to an oncologist. Okay, because I just, probably nothing, but let's, step 2, went to see an oncologist. I'll fast forward because we don't have all day, but this is very emotional for me. I met with the oncologist, additional test, and December 23rd, as I was packing, getting ready to move, preparing for the holidays, planning on seeing my family, the doctor calls and says, you have cancer. I had an out-of-body experience. Not me, I've done everything, why me? Redo that test, do that again. Kudos to my doctor, Dr. Evelyn Cantillo with Weill Cornell Medicine. I have to give her a shout out. She stayed on the phone with me, talked to me, told me everything, that information. She goes, I'll stay with you, and I'll talk you through. In any event, but she noted that I would have to have a biopsy. We didn't know what stage a cancer, but I would have a biopsy that was scheduled in January. I'm still this is not happening to me, but I went through the surgery on February 8th. She told me, yes, you have cancer, but it's stage 1A. And the good news, it's stage 1A, so because you came early when you saw the signs. So early detection is extremely important, I'm here to tell you. And so, I chose to have chemo. I had a choice between chemo and radiation. I chose chemo. Cancer is hard. Chemo and cancer are harder, very hard, isolating, lonely. Mentally, physically, it breaks you down and eventually builds you up at some point, emotionally. And so I joined with the advice of my doctor, Dr. Cantillo. She said, there are a few groups. Check out some of these groups that may just support groups. And so I joined one of them, which we'll talk about some more later. And so that has helped me through the process as well. So had chemo started February 15th, ended May 31st. June 14th, I went to get my CT scan, and the evening of June 14th, I received a message, no evidence of disease. So, I'm counting 65 days. And so I am grateful, I am thankful, I'm very, for my family and friends, and my doctor, my healthcare, the professionals, because my doctor was amazing, the nurses were amazing, and the social worker was amazing who referred me to Ikana. So.
Yes, you are. You are amazing. Thank you so much for sharing your story with us. You are a survivor, and we know you're going to do well. And now turning to Patient Ambassador Tiffany Drummond, and as we said, board member of ICANA. Will you please share your story with us?
Sure. Hello, everyone. My name is Tiffany, and as you heard, I do have a background in clinical research. I've been doing that for about 20 years, so you can just think that I did it when I started at 2 years old. So for me, I was doing cancer work as part of my job. And then when cancer became personal, that's when things took a turn for me. Because my mother was diagnosed with stage 3 endometrial cancer at the age of 62, right? And so, we'll talk about, symptoms and, again, early detection. And so I thought, my mission now isn't just working in clinical research. My mission now is to be a patient advocate for people like my mother who don't have that opportunity but can have that opportunity to survive. And so I came into contact with Dr. Bhavana Pathuri, who's at NYU. I used to work with her, but she got me in contact with Dr. Kimmy Dahl, who is a GYN oncologist out of Seattle, Washington, and she created this organization, Endometrial Cancer Action Network for African Americans, in 2017, and turned the reins over to our current president and survivor, Adrienne Moore. And so what I want to just for you to take away, if anything, because we don't have all day like my good girl here just said, is create, support, and empower. That is what ICANA does. We create a space for black women, whether you are a healthcare provider, whether you are a survivor, whether you are going through it right now, newly diagnosed, or whether you are someone like me who is a loved one, or you are in memory of and supporting a mission of someone who lost that good fight, right? We also support. You can come to ICANA and you can ask any question you want to. You can come and you can say, this is something that I'm experiencing, and of course with our GYN health, we don't want to talk about that, right? Especially in the black community, we don't want to talk about anything, right? So, those are things you can come into this space and ask, right? And don't feel that guilt or shame. And the last thing is empower. Even though I teach clinical research now, I am more on the patient advocacy side because I want to, and I think we all on this panel want to empower you. Knowledge is power. And I am so about clinical research because what happens is that all of the data that you see, all of the drugs that are approved are based on data that are not about people who it affects the most. So you can have a clinical trial where you know that black women die 2 times as much, but they're only maybe 5% of the population in the clinical trial. Doesn't make any sense, right? So anyway, that's what I want you to take away from ICANA, right? Okay? Create, support, and empower. Thank you.
Thank you so much. And you brought up some really important points, and we're going to come back to you in 1 second. Patient Ambassador Drummond, will you please tell us about the Spot Her initiatives and the efforts to end the silence around endometrial cancer?
I think you got it confused.
I know,
Oh,
we do look alike, and I used to have a buzz cut too.
That happened. Sorry about that.
No. So really quick, I'm gonna take a minute on this. Shout out to my AZI table in the back there. We're gonna have a party later. So the Spot Her campaign is sponsored by AZI, which is a pharmaceutical company, and we're in partnership, ICANA, with them. Spot Her really is kind of what I talked about, right? If you are premenopausal and you're having heavy periods or you're having heavy cramps and things like that, these are things that you don't want to ignore. And if, like my mother, you are postmenopausal, you should not be bleeding at all. So you see one spot, that is something that you should take note of, right? But not even take note of like, my girl Angelica did here, not a mental note, no, go see someone. right away, right? So this Spot Her campaign really is about that, and I encourage you to go to you can even Google it, Spot Her campaign, and please visit the table right there because I think it's so important for us.
If I may add about the symptoms, just a little more, bleeding is number one. The other thing, or heavier bleeding or bleeding after your menopause, all of those things. Also, you may notice discharge. In some people, it's just, oh, I'm noticing a discharge that's different from what I used to have before. Maybe it's thicker mucus or something else. Sometimes it's back pain. Just if you notice anything in the abdominal or pelvic region or vaginal region that's new, that's not supposed to be your normal, talk to someone. Go find medical help.
Right, and I just want to, you don't need to immediately get concerned. Usually, it's just hormones or an abnormal period, right? But what they were saying is get it checked out. And you can go to putting a plug in here as a generalist OBGYN for over 20 years. Go see your primary care doctor, your primary OBGYN. We're the ones who diagnose it, and then we'll do the referral. So before we end, just one question for the panel. What can we do now to spread the word other than events like this?
I'd say pay it forward. You know, this is information. Tiffany said knowledge is power. Don't keep it to yourself, you know, at all. So share with your aunt, your mother, your coworker, the importance of getting examined every year, getting your annual exams. And if you see something, say something, for sure.
Okay. So we have about 5 minutes left, and we're going to open this up for the audience. Yes, ma'am. I'm going to play Oprah today.
I'm going through that right now, and I had like 2 DNCs, and they keeping on, and they want me to have a hysterectomy. But who can I talk to on the panel or organization or something you said?
Well, I'm just going to say that you should really go to your OBGYN and talk to them about your options. The question was, she's had some episodes of abnormal bleeding, DNCs, a couple of other procedures. Obviously, they haven't found cancer. However, if you need further management, I would speak to my generalist doctor. Thanks. We have another question.
Yes, I was at my GYN a couple weeks ago, and she told me I don't have to have a pap smear no more because I'm over 60. Is that true? Because how are you going to detect if I don't have it every year?
Thank you. So the pap smear is an evaluation for cervical cancer. There were new guidelines that were issued. That would probably be a whole nother session. I would say have another conversation with your physician about your personal risks. Is there another mic? There's another mic.
Mike back here.
Hello, my question was about the symptoms. You kind of answered part of it, but do you always see symptoms with this cancer?
Some people don't have symptoms, but the overwhelming majority do.
Okay.
So if you have any of those symptoms I talked about, go in. If you don't have symptoms, how else can it be found? I think that's your question.
That's really what I'm getting to. Yes.
Unfortunately, there's no screening tests. Like we have mammograms for breast cancer. We have the pap test for cervical cancer. We don't have a screening test right now for uterine cancer, but people are doing research into what else, can be done. How else may we be able to detect these cancers early? So hopefully within the next 5 years. But in the interim, it's just really to watch out, check your body, see if you notice anything, and have regular GYN visits. And especially for my older women here, I have a lot of people who say, do I really need to go to the GYN? I'm 70. Age is nothing but a number. And the GYN does more than pap tests.
Yeah.
They have to look at the outside, they look at the inside, even if you're no longer sexually active.
Dr.
Right.
Mulligan, we have one last question over there.
I didn't
I'm
finish.
so
I didn't finish when I was there. Is it okay to ask your doctor to do a test even if you don't have symptoms?
So I think you can always ask them, but sometimes tests pick up things that are that's the risk. That's why we don't just always do tests, because if we see something that looks kind of funny, we go down this road of doing all these procedures that weren't really necessary. If you have conditions that predispose you, like there's another condition called endometrial hyperplasia. In that instance, someone might say, okay, let's do an ultrasound of your uterus every so often. But I wouldn't start chasing it unless there's something there.
And doctors follow guidelines, so we need to be within the guidelines for our practice. One last question on that side of the room.
Really, I was piggybacking on the pap smear because I was told by GYN that they don't do pap smears after 64. And you see that guidelines, you know.
I
so
think the most current guidelines are after the age of 65 without other risk factors. Those are the current guidelines, and again, that needs to be a conversation with your physician. And right before we conclude, I do have to do a public service message. So everyone should visit the Meet Me at the Spot mobile activation at the Harlem Week Health Fair on Sunday, August 20th. So write it down in your calendar, Sunday, August 20th, Meet Me at the Spot. It's part of the Harlem Health Fair. Thank you all so much for joining us today. Those of you online, thank you. We appreciate you as the audience.